So we just started the second dose. Now, has Nigeria gotten the required vaccines?
We haven't got the required vaccines yet. We are giving the second dose to all those who have received the dose number 1, so that we can have a pool of people who have received full immunization while we wait for more doses to arrive of these vaccines for other Nigerians.
You said why we wait for it seems we are hoping that this might not be the reality. Are we sure?
Yes, we are sure. It's only a question of when it will be, because vaccine manufacturers now are under pressure to deliver to those countries who are really suffering. As you know, India and some other countries are having very serious waves and are deciding to take care of their own problem, particularly India, who supplied us the ones we are using now. So we are working with in bilateral conversations with other manufacturers in South Africa, where latest by August we hope to get Johnson & Johnson vaccines, and then bilateral conversation with countries who should be ready to give us surpluses of what they have, so that we can continue our vaccination program.
Yes, seeing some new variants, across the world. How prepared is Nigeria for this?
Well, we are watching very closely. We are doing genetic sequencing to recognize the variants that are coming to our country, and reading also about the variants in other countries, and preparing ourselves. That is the reason we are anxious to continue with vaccination, and also to make it clear that the vaccination alone is not the answer. We need to continue with the non-pharmaceutical interventions and the public health rules that have been laid down by the President in the health regulations that were signed recently. So we need to continue wearing our masks. We need to continue social distancing. Above all, we need to avoid all those mass gatherings that are the cause of the huge explosions that occurred in other countries.
Thank you.
Thank you.
Thank you so much. So in the first phase, so how many Nigerians were vaccinated, and how many do you hope to vaccinate now in the second phase?
So we started off by targeting 2 million Nigerians with the 4 million doses of AstraZeneca we received, so that at the end of the day we'll have full vaccination of Nigerians. 2 million Nigerians that are fully vaccinated, rather than 4 million Nigerians that are partially vaccinated, especially because of the global supply that is really stringent. So far, we've been able to vaccinate 1,950,000 Nigerians with the first dose. That's about 97% of the 2 million people that we've targeted. But we've also started the process of vaccinating Nigerians with the second dose. We've been able to vaccinate up to 34,000 Nigerians so far. A lot of the states are ramping up this vaccination process so that at the end of the day, we'll be able to finish up this vaccination by the end of June or early July.
Now, what's the kind of challenge you've really faced, and what have you done in terms of people's attitude and towards this?
One of the biggest challenges that we face as a country is the unpredictability of the supply. The Presidential Steering Committee is working with the Federal Ministry of Health to ensure that we get the second consignment of vaccines as soon as possible. There are projections that we should be able to get the second consignment by the end of July or August. But we're still trying to fast track that process so that immediately after we finish giving the second doses, we'll be able to get more doses for Nigerians. Clearly, we have to make the vaccines available so that Nigerians can be protected from the Covid-19 virus. Of course, the challenge there too is that the longer we delay, the longer we wait without vaccinations, then the higher the risks that we might import strains that might be difficult to control. Nevertheless, I know that from our conversations with the COVAX facility, with the African Union, that we're going to get vaccines into Nigeria sooner than later. The other challenge that we face, of course, is that of vaccine hesitancy. Right, this is a global phenomenon. It's not unique to Nigeria. However, we've been able to work with stakeholders. We've been working with the Federal Ministry of Information, the National Orientation Agency, our development partners, our donors, to craft out how we can engage even more intimately with the traditional leaders, religious leaders, because we know from our experience with the polio eradication program, where we had a massive opposition, especially in the north, to oral polio vaccines. We know that we have to do the same thing all over again. Get to the communities, get community ownership, buy-in, so that they know that these vaccines are safe, that they are effective, and that is exactly what we're doing. And we're very grateful to the media for all of the support that they've been providing, the collaboration in making sure that only the correct information is out there. We know that there's a lot of misinformation and disinformation that is going out there, especially in social media, right? But I also know that if as scientists we put the correct information out there, Nigerians are rational, and over time, from being cynical about the vaccines, they'll come around and understand that there's a lot of information that is fake news that is out there. Nigerians and all of the the institutions that have been set up to ensure that only safe and effective vaccines are provided to Nigerians will make sure that nothing short of that will be done. Mr. President, the Vice President, and notable Nigerians have already taken the vaccines. This is what gives us confidence that these vaccines are safe and effective. We're also going to, as the Presidential Steering Committee, take our second dose in the full glare of the public, again, to engender confidence that these vaccines are safe. But beyond that, we have almost 2 million Nigerians that have taken the vaccines, right? And we've not had any report of anybody dying as a result of side effects. Clearly, with every vaccine, there may be some mild side effects, such as mild fever, body pain, some headaches, but usually this goes after 2 to 3 days. And, it gives you the opportunity to, of course, be protected against the virus.
Thank you very much.
Yeah, thank you.